Okay. All right, hello. So I have my patient here today. I am her student nurse practitioner. We're going to be doing a focused neurological and musculoskeletal examination here today. Prior to beginning this exam, I did my hand hygiene. I obtained consent from parent. I'm allowing a safe space and privacy for her, which is appropriate for her age group, and I'm ensuring that she's comfortable. So starting off with just a brief history, she presents here today for a routine well visit. She has no complaints, neurological or musculoskeletal complaints. No past medical history. She's not on any medications, and there are no known allergies. Moving on, I will just state her vital signs. So her vital signs are all within normal limits. Her temperature was 98.6. Her respiratory rate was 70 beats per minute. Her respiratory rate was 16 breaths per minute. Blood pressure 110/68. She's on room air, statin 99%. Height and weight appropriate for age, and BMI is within a healthy percentile. So, okay, so I'm gonna start with her neurological exam. Can you tell me your phone number?
Bethany Vanderpool.
Okay, what is your date of birth?
12/27/09.
All right, do you know where we are today?
I'm in your apartment.
Yes, you are. And what's today's date?
It's Tuesday, June 30th.
Okay, and why are we here?
To do a medical exam.
Okay, perfect. So she was able to answer all those questions appropriately. So her speech, her behavior, her mood, all are normal findings and all expected findings. She is alert, she is oriented to place, time, and situation. Speech is clear and fluent, an appropriate mood, and everything. So next I'm gonna move on with her cranial nerve. We're gonna start with cranial nerve 2, which are optic. I have my chart here. I'm gonna ask you to cover one of your eyes for me first, and then read the smallest line you can.
LTFPH.
Okay, and then do the other thing for the same thing for the other eye.
LTFPH.
Okay, so patient obviously has her glasses on, and she is 20/20 vision with her glasses on. So those are all expected findings. Visual acuity is intact, visual field is full. So moving on, we're gonna do cranial nerves 3, 4, and 6. So I'm gonna stand in front of my patient. Can you follow my finger with your eyes, don't move your head, okay? Perfect. All right, and she was able to do that appropriately, which is a normal finding. So her movements are intact. There's no lazy eye. Pupils, with my light here, let me check your pupils. They're normal, equal, and reactive. That's right, sorry. She said, oop. Okay. So, like I said, pupils are equal, round, reactive to light, and accommodate. Moving on to cranial nerve 5, I'm going to touch your face, and you just tell me yes or no if you can feel me touching you.
Yes.
Okay.
Yes.
Okay.
Yes.
Okay, and I'll punch your jaw for me. Okay, perfect. So she was able to do that and feel all that. So facial sensation is intact, and her jaw muscles are equal bilaterally. Moving on to cranial nerve 7. So can you smile for me? Can you lift up your eyebrows? Can you close your eyes really tight? Can you puff out your cheeks? Perfect. So she was able to move all those facial expressions. They're all symmetrical, which is expected finding. Next, we're going to move on to central nerve 8, which is hearing. I'm going to stand a few foot behind her, and can you cover your, yep, and I'm going to whisper a word. You tell me if you can hear it.
Dog.
Okay, and I'll do the same for the other ear. And I'm gonna whisper another word.
Car.
Okay, perfect. So she was able to hear me correctly. So cranial nerve 8 is intact, hearing intact bilaterally. Moving on to cranial nerve 9 and 10. Can you open up your mouth and say Perfect. All right. So cranial nerve 9 and 10 are intact. Her uvula rises midline, symmetrical palate. Her speech is clear. Moving on to cranial nerve 11. Can you shrug your shoulders for me? Okay, perfect. And now turn your head against resistance. Yeah, perfect. Perfect. Okay, so she was able to do that correctly again. Expected findings, her shoulder shrug is strong and equal, and she has 5 out of 5 bilateral strength. And then lastly, cranial nerve 12. Can you stick out your tongue for me? All right, perfect. So she was able to do that for me. Her tongue is midline, all expected findings. All right, so moving on, we are going to do motor function. So I'm gonna start by just expecting her. I'm not noticing any tremors, any asymmetric muscle development. Let's palpate next. So, okay, so I'm not feeling any contractures or any abnormalities. Everything on palpation is an expected normal finding. Muscle tone is normal and no pain when I was touching you.
No.
So no tenderness. Perfect. Next, we're gonna do strength. All right, so push against resistance with your hands. Yep, up, down, your elbows, up, down, now push out, and then in, perfect, and then legs, perfect, and then feet, up, down, okay. So strength is a 5 out of 5 bilaterally, which is all a normal and expected finding. Next, I'm gonna have you stand. A little bit out the way, and I'm just gonna have you walk as you normally would. Yep, perfect. All right, so expected finding, her gait is smooth and coordinated. She has good posture. Next, can you do the same thing but walk on your heels? Yep, again, normal finding. She was able to keep her balance and didn't perform that with any difficulty. Do that again, but on your tippy toes. Yep. Perfect, beautiful. Okay, she performed that also with any difficulties. She did a great job. Next, I need you to hop one foot, hop other foot. Perfect. So she was able to do that without any difficulty and maintains her balance. Moving on to the Romberg test. Just close your eyes and just stand there to see if you. Yep, just close your eyes. Perfect. So she was able to maintain her balance, which is a negative Romberg. Okay, you can open up your eyes. Next, similarly, I'm gonna ask you to stand there again. Close your eyes and just have your arms out. So I'm looking for any drift, which I don't see any, which is an expected normal finding. Okay, you can put your arms down. That was perfect. Moving on. Let's see, I'm gonna have you sit again. Standing and sitting, but have a seat for me. So we're gonna do finger to nose. So just touch your nose and then my finger. Perfect, perfect. Okay, so she was able to do that successfully, accurate movements. Okay, so moving on, we're gonna do her sensory function. I'm going to touch you and you tell me if you feel me touching. Just close your eyes for me.
Yes. 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 Yes.
Okay, so she was able to identify me touching her appropriately. So those are all sensations intact, normal finding. Next, we're gonna do test her pain. Tell me if when I touch you, is it dull or is it sharp? Okay, close your eyes.
Sharp.
Okay.
Dull.
Okay.
Sharp.
Okay.
Dull.
Okay.
Sharp.
Okay, and she was able to identify that correctly. So she was able to correctly distinguish sharp and dull. Next, I'm just gonna do temperature. I have something in my hand. Close your eyes and tell me if it's hot or cold.
Oh, cold.
Sorry.
Oh, cold.
Okay, it's cold. It's very cold. Sorry. Okay, so she was able to correctly identify that temperature sensation is intact. All right, next we're gonna see if you can distinguish. Close your eyes for me, and I'm gonna touch your fingers and your toes and tell me if I'm moving them up or down. Okay.
Up.
Okay.
Down.
Okay.
Up.
Okay.
Down.
Okay.
No. Up.
Yeah. No, correct. Yeah, yeah, good. One more.
Down.
Okay, perfect. All right, so she was able to correctly identify those positions. Moving on, we're gonna do reflexes. So I have my little hammer here. I'm not gonna hit you with it very hard, but we're gonna test your reflexes, okay? So I'm just gonna hit your arm in certain areas, but yeah, have your arm, yep, like that. All right, +2. Another little tap, have your arm, yep. Okay, +2. Then we're gonna do here. Turn it this way, yeah. Relax. Okay, +2. +2. Okay, And then let me do the Achilles. +2. +2. Your knees. +2. +2. Okay, so those are all normal expected findings. Her reflexes are all +2, which is expected. Moving, let me do your hands, or just gonna tickle your feet. Okay, so those are intact. She's very ticklish, but she curled her toes, which is an expected finding. Okay, so moving on, we are going to do the musculoskeletal. So her posture, just looking at her, she is sitting upright. I don't see any deformities. Her shoulders are symmetrical. Very lovely, very beautiful. Moving on. Scoliosis. Okay, so can you just stand up for me again? All right, facing the other way. I want to see your back. I'm gonna, your hair to the side. So it's just her standing there. I'm just looking at her spine and her hips. Everything looks symmetrical. I'm gonna ask you to lean all the way forward. Again, looking at her spine and her hip. Nothing's lifting, nothing's asymmetrical, and her spine is nice and symmetrical. So all expected findings. Okay, you're good. You can have a seat for me. So all that is normal. Her spine is straight. There's no rib hump. There's no asymptomy. Everything is normal. All right, so moving on, range of motion. So I'm gonna ask you to stand again, sorry. So we can have a little more space in the frame. Okay, so we're gonna do cervical spine. So move up, look all the way up for me. Yep, side, side. All right, perfect. And you could tilt your head up, down. Okay, perfect. So all that range of motion, full range of motion, no pain. No. Beautiful. And then raise your arm for me. All the way up, all the way down, both of them. Oh. Like you're on a roller coaster. Yep, all the way down. Yep, perfect. Bend your elbows, like lifting weights. Yep, perfect. And rotate your shoulders. Okay, full range of motion, no pain. No. Perfect. So all normal. Then we're gonna do the lower extremity. So lift up your knees, bend them for me, both of them. Yep, and the other one. Rotate your hips up. Perfect. And then your ankles. Okay, perfect. So full range of motion. You can have a seat again. So we can go do the diagnosis. Have a seat. All right, so we're at the end of everything. So I just want to talk about the diagnosis. So I would say her diagnosis is encounter for routine child health examination without any abnormal findings. Z's 00.129. There are no neurological or musculoskeletal abnormalities identified. As for a differential diagnosis, if there were any abnormal findings present, I would say we can do scoliosis, M for 1.9, and or we can also do another differential diagnosis, muscle weakness, M 62.81. But again, there were no abnormal findings. And that concludes my video. Bye.